I am Aarti Kulshrestha. I'm a pediatrician, and this is Ask the Doctor Live from Emanate Health. We're going to be talking about going back to school and COVID-19. I'm an independent physician in private practice, and I'm affiliated with the Emanate Health system. And just a little bit about Emanate Health. We are a 3-hospital system. We have hospice care, we have ambulatory centers, and we serve nearly 1 million people in San Gabriel Valley in LA County. So let's talk a little bit about COVID in children, and then we'll move on to trying to go back to school. So COVID-19 in the pediatric population. As you know, COVID-19 has not really been a big factor in pediatrics in the sense that we have had a lot of children infected, but we haven't had a lot of children hospitalized, which is great from my perspective. But I do want to emphasize that we do have a lot of children that are infected, and it is a disease that is significant even in the pediatric population. I've put this slide up, and it's, again, a snapshot in time. I know the data keeps changing, but there are about 3.2 million children who were infected with COVID-19. These numbers may be less than what we anticipated or what may be real, since a lot of children do have asymptomatic infections and may not have been tested. We have had 266 deaths in children from COVID-19, and to put this into perspective, this last flu season, the 2020-2021 flu season, we had 188 deaths in children from flu. So COVID-19 has been more deadly than influenza this last season. In LA County, we've had about 150,000 children who've been infected. It's about, and the numbers vary, but about 11 to 13% of the total cases. We have had 3 deaths in LA County itself. If you look at the proportion of deaths to the total number of deaths in our elderly population and older adults, it's not very significant. And again, that's a blessing. The one thing I also do want to mention is this new syndrome that's come about that we've learned about from COVID-19, and that's the multi-system inflammatory syndrome in children, or MISC. So the total cases in the US, and again, this is CDC data, this is as of March 1st, they update their numbers every month. So the total number of cases in the entire United States for MISC has been, 2,617, and the total number of deaths for the pediatric population from MISCs is 33. Some of the demographics, some of the epidemiology behind this, most of the cases were children between ages 1 and 14. However, the total number of cases went from less than age 1 to, age 20 years. 66% of the cases have occurred in children who were Hispanic or Latino or Black non-Hispanic. 99% of the cases were positive for the SARS-CoV-2 virus, and the remaining 1% were exposed to somebody with COVID-19. The multi-system inflammatory syndrome in children actually shows up about 2 to 4 weeks after the initial infection, which is why we may or may not pick up somebody with the SARS-CoV-2 virus. They may not be positive at the time that we diagnose MISC. And so essentially what happens in children is that you have the initial infection, you have maybe a fever or something, seems like it resolves and everything's great. 2 to 4 weeks later, you suddenly start to feel, the child suddenly starts to feel much more ill, they get a recurrence of the fever, and these children are very, very ill. So this is not something that's suddenly going to be missed, okay? So let's talk about going back to school. I know the CDC has come out with new guidelines. I know LA County has come out with new guidelines. As LA County moves into the red tier, we have talked about the reopening of schools. There are a lot of questions that are coming up with going back to school and COVID-19. Should children head back to school? Should they wear a mask? Is it safe to wear a mask? Can children get the COVID vaccine? Is the vaccine going to be required to go back to school? I'm going to answer some of these questions to the best of my ability. If you do have other questions, please go ahead and mention them in the comment box, and we will try and get to them at the end. Should children head back to in-person learning? The AAP, the American Academy of Pediatrics, has advised that we do try and get our children back to school for in-person learning. What we have to realize is that the schools are not just there for the educational development of children. They provide social development, emotional development, physical development. They're there for special services, speech therapy, for example. They provide nutrition. They're a safe and stimulating place to be. A parent knows when they drop their child off to school, they are in an environment and the parent is then able to go to work and pick their child up. And, this is what we expect. The children also are stimulated when they are there in multiple areas. There has been a lot of stress in our homes with people trying to do remote learning. For the children, especially for our special needs children, for children with ADHD, with autistic spectrum disorder, it's very hard for them to be at home with remote learning. There are stresses on the parents to try and navigate online services, online teaching. There are parents that have to quit their jobs or stay at home to try and get these children to get the learning that they need. So as child advocates, as pediatricians, when we advocate solely for the child, we want our children back in schools. However, we do realize that there are many other factors that we need to consider. Schools have not been a significant driver of SARS-CoV-2 infections and transmission. Especially in our younger children, we have very low transmission rates. This is interesting because usually in every other infection, we have very high transmission rates in all of our children, especially in schools and daycares. But for some reason, the data shows that they have not been a significant driver. Where is this data from? It's from other states where children are in in-person learning. So the basic tenets that the CDC has come up with for being safe in schools are masks and cloth face coverings for children greater than 2 years of age, enforcing social distancing, improving the air circulation. There's no single action or plan that's going to eliminate the risk of virus spread in schools, but what we can do our best at is mitigate, control what we can and try and mitigate the spread as much as we can. So we're going to talk about masks. Now, I understand that people have been with masks for some time, but as our children need to wear masks for a longer period of time, for in-person learning, for all day at school, we do come up with, how do I get my child used to wearing a mask? So these are some of the things you can do, especially for our younger kids. Look in the mirror with the mask on. Definitely talk about it and how important it is to keep the mask on. Decorate them, make them personal, make them fun. Show them pictures of other children with masks so they know that they are not the only ones. Put a mask on a favorite stuffed animal, draw one on a favorite book character, practice wearing them at home for longer periods of time so that they can get used to it. And I would say everyone at home can try and practice wearing it so they can get used to seeing people with masks on for a long period of time. Can wearing a mask make it harder to breathe? So cloth masks, which are what's been recommended, they're made of breathable materials. Masks will not block oxygen that your child needs. Masks will not affect the ability to learn or focus in school. There was another question that came up that it's possible that it could affect speech and speech development. Again, we don't have enough data on this, but for the most part, it may affect the pronunciation since they can't hear the correct articulation or it may be slightly muffled, but the words, we do understand people when they talk with the cloth masks on. So we do recommend that they have the masks on while they're in school. The vast majority of children, and that's everyone over age 2, they can safely wear a cloth face covering for extended periods of time. Masks can be worn with many, many medical conditions. Usually the only exceptions are children under the age of 2 and children who have a decreased cognitive ability or motor ability and cannot remove the mask by themselves. that really tends to be the only people that don't need to wear masks, or we don't recommend wearing masks. Can masks interfere with a child's lung development? No. The short answer is no. So the cloth masks, again, are made of breathable materials. The oxygen is going to get through. What masks will do is they're going to block the spray of spit and respiratory droplets that may contain viruses. So actually keeping your child's lungs healthy includes preventing infections like COVID-19, possibly flu, and every other virus that's out there. So wearing a mask may actually, your child may benefit as far as their lung development is concerned. Do masks trap the carbon dioxide? Again, the short answer is no. They're made of breathable materials. The oxygen will get through, the carbon dioxide will get out. It will not trap the carbon dioxide. The oxygen and carbon dioxide molecules are tiny, 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 much smaller than the respiratory droplets. So these masks, these molecules cannot be trapped by the masks. We have to remember that surgeons wear tight-fitting masks all day long for their job, and there is no harm for them. So how do they work? They create a barrier. They reduce the spray of a person's spit and respiratory droplets. These droplets carry the virus. The masks protect you from other people's droplets as well. Another benefit, a side benefit, is going to be it may stop the children from touching their nose and mouth when they've touched other surfaces. Social distancing. So the other tenet that for schools to safely reopen is social distancing, and the new CDC guidelines talk about 3 feet versus 6 feet. So the decisions were made on MMWR, morbidity and mortality weekly reports, and there's data that came out of Florida and Utah and other states that have had in-person learning, that have had a distance of 3 feet versus 6 feet when they've been open for in-person instruction. And what they found is that, again, the transmission rates in our younger population, TK to 5, tends to be very low. And so really, elementary schools can place desks 3 feet apart, and it should be okay. The caveat is that this is data that has come out, and we are basing it on this data. As more and more data comes out, these guidelines can be modified. We can only base our guidelines based on the data that's currently available, and this seems to be what's out there. The other thing that the CDC does say is that the teachers or other adults still need 6 feet between them and their students. Masks should be worn at all times, and there should be adequate air ventilation. That is required in order for the social distancing to work. The way I'd like to sort of explain it to you, I do have a diagram, and essentially the 3 feet versus 6 feet. So your larger respiratory droplets, when we speak, there is a spray that comes out when we breathe, when we cough, when we sneeze. The larger respiratory droplets usually will fall within 3 feet. In fact, in pre-COVID times, when people came to the clinic, we'd usually say about 3 feet of distance, that's all you need. About 3 feet of distance, that's all you need. In the pandemic with COVID-19, we've increased that to 6 feet because we want to be doubly sure that there is no spread. And again, with children, they don't generate enough pressure to spew out as much as we do as adults. So in 3 feet, we really expect a lot of these large respiratory droplets that contain thousands of virus particles to drop to the ground so it doesn't reach the other person. In this picture, of course, the gentleman isn't wearing a mask, and so with a mask on, you expect even less of the droplets to come out and go down. The smaller air, respiratory droplets that are in the air, this is why we need the improved air circulation, and hopefully as they go, they will disperse, and hopefully that's how our transmission is not going to be that high when these children go back to school. The other thing I do want to mention is that in a classroom, as you can imagine, it's usually the teacher should be doing most of the speaking, and they are 6 feet away. The children are all facing the teacher, so if one of them does speak, they're speaking into the back or maybe diagonally to the side, but they're not actually speaking face-to-face with other students. And so that could also help understand why 3 feet may be okay for our younger children. You do want to talk to your children about how schools will look different. The desks will be farther apart, especially your younger children who may not understand. The children may be required to stay inside for lunch, for recess, if they have lunch and recess. They may be playing and interacting with their friends differently. You know, running out to the tetherball court may not be an option. We'll see. Masks will be required at all times at school. And of course, hand sanitizer, washing your hands. Chances are there will be some rules in place when they do go back to school. Vaccines. So are children and teens going to get the vaccines? Children are not simply small adults. So we cannot assume a vaccine will have the same results on a child or even a teen. For children 12 to 17 years of age, Pfizer for the children that are 12 to 15 years of age, and Moderna for the 12 to 17-year-olds, they have finished enrolling patients for their studies. This age group will probably receive the same dose as adults. We expect that this data is going to be analyzed sometime this summer, and so it may be that a vaccine is available for our middle school and high schoolers before the 2021-22 school year starts. Being available and being able to get it shot into the arm, it will depend on the timing of the vaccine availability. It will depend on the results, the efficacy. For the younger children, they aren't studying the vaccine for children less than 6 months of age. We do know that our younger children do not respond to vaccines as well as adults and even the older children. So Moderna has started a study for this age group. Pfizer is going to be starting soon. But this study is going to be a little bit more complicated because the dose may need to be adjusted. It may be that they do not get the dose that the adults get. And we need to figure out what is the lowest dose possible so that we have a good safety profile. And yet, when we give them a lower dose, we still need that vaccine to be effective. Now remember, for these studies for children, the effectiveness of the vaccine, what we're looking for is simply antibody levels. For adults, we were able to say we kept them out of the hospital, we kept them from getting severe disease. Since we don't have a lot of children in the hospital getting admitted or having severe disease, all we can say is that if they have the antibody level that adults do, hopefully they will be just as protected. So that's what we're looking for. So again, these younger children, they may not have the same response that adults do. They may need a booster vaccine. There are many, many, many questions that need to be answered before the vaccine can be rolled out for young children and teens. Will a vaccine be required for school entry? Whether or not a vaccine is required for school entry is actually a state government decision. So this is not something that I'm qualified to answer, and there are many other variables that are going to go into the results of the vaccine, the efficacy of the vaccine, that are going to go into this question. So this is not even a question that I'm prepared or qualified to answer. Remember, there are other vaccines that are required for school entry. Children need to be vaccinated regularly, and these are considered essential visits. The CDC does recommend the flu vaccine this year, probably also for the next year, since flu-like symptoms mimic COVID symptoms. Medical offices are open for well child visits and offer routine vaccinations. And medical offices have made adjustments to decrease the exposure to other patients during this pandemic. So I really encourage you to not delay care, to seek out care for your children who need to be vaccinated. Emanate Health exists to help keep people well in mind, body, and spirit. This is their mission statement. And we're trying to do so by providing quality healthcare services in a safe and compassionate environment. The Emanate Health System, there are, again, multiple hospitals, multiple ambulatory centers. And so I do recommend that I will give the Emanate Health Pediatric line in just a minute. I was going to say one more thing, and that is that there is a CDC checklist There's a website that's available. I'm just going to touch on some salient points in this checklist. But the CDC did come out with a checklist for planning to go back to in-person classes. One is, of course, if your child is ill, please don't send them to school. The other one is you may have to, your morning routine may include checking for masks, checking for extra hand sanitizer. You may have to put in their own water bottle so that they aren't sharing things with other students. So develop daily routines before and after school. After school, the mask goes into the washing machine or something like that. The hands get sanitized or washed so that, again, we are trying to decrease the amount of transmission that does happen. Talk to your children about the precautions to take at school, what they may be expected to do while they're there, what they're now going to be expected to do once they come home. Transportation, the schools and special services. The schools are going to come up with different ways to try and figure out busing students back and forth, because this seems to be a way that, you know, the COVID-19 can get transmitted between students. Speech services, occupational therapy, physical therapy, everything like that, all of your therapies that are usually one-on-one or in small cohorts. Again, the schools will have to come up with a plan, and I encourage you to ask your schools or your administrators how they plan to provide these services when children head back to in-person learning. And here's that number. So don't delay your care. Find a doctor. You can go to Emanate Health Pediatrics. You can go to the website, or you can call to make your appointment and get vaccinated. I believe questions are now coming through on the phone. So let's see. Will getting my child all of their shots help protect them from getting sick with COVID-19? When your child is vaccinated, you're protecting them against every other illness that may mimic COVID-19. They certainly will have a stronger immune system for it. But since COVID-19 is a new virus, will it protect them specifically against COVID-19? I don't believe so. Are teachers getting vaccinated in schools now? I believe our educators are allowed to get the vaccine. They should be able to sign up on My Turn just like everybody else, and they certainly are. It's available to them. Whether they do or they don't, it is not required by the CDC or by the LA County or by school districts that they have the vaccine before they come into schools, before the schools get started again for in-person learning. Should I schedule a checkup with a pediatrician before sending my child back to school? You should schedule a checkup with your pediatrician for their routine care. If that means that they haven't had one in the last year due to the pandemic, I would recommend that they get their routine checkup. How often should I wash my child's mask? Daily. I would say daily. So when they head back to in-person school, what we expect is that that mask is going to have, what we should expect, what we should pretend is that that mask is going to have COVID-19 on there somewhere. And so hopefully as soon as they come home, either they have another mask to replace it with, and you have, you know, one for each day of the week, and they all get washed at the end of the week, or whatever it is that you prefer to do at home. But I would say they should have a new mask daily. What can I say to encourage my coworkers and fellow parents to get vaccinated to help herd immunity? I believe in vaccines. I'm a pediatrician. I have been vaccinated. I encourage everybody to get vaccines. I do believe herd immunity is going to help us get back to pre-COVID times where we can enjoy things that we were taking for granted, going on trips, meeting with family. I don't know of anything to say or do to encourage other people to do it. I can only say that I certainly believe in it. And I think that is the last question. So again, let me say, don't delay your care. See your pediatrician, get vaccinated, and hopefully our children will head back to in-person learning. And of course, as soon as I said that, I guess there's another question coming in. Should children be sent to school with a face shield, or is a mask enough? A mask is enough. A mask is enough. We do have face shields for healthcare workers who have a much closer proximity to other patients who are probably, and they're probably exposed, because again, these are patients, these are ill patients or sick patients that are in the hospital. So they, we do require face shields for them. For children, masks should be enough because we do anticipate that they are going to have social distancing. All right, and with that, thank you. And this was Ask Your Doctor Live at Emanate Health.